Good afternoon.
Good afternoon. Thank you. Thank you for hearing my testimony in support of Bill 349. My name is Tyler Boyson. I'm a student at the University of Connecticut and a member of Students for Sensible Drug Policy on that campus. Our university is struggling economically alongside the state, and this bill directly pertains to our economic crisis. Additionally, in the past few months, I've wondered how many people, due to loss of financial aid, will be forced out of education during this crisis. Additionally, on a few of the law enforcement statistics relevant to marijuana in Connecticut, I was struck by another crisis of lost potential, and that's Connecticut's youth. According to the National Organization for the Reform of Marijuana Laws in their Connecticut Arrest Report, in 2002 alone, 6,400 people roughly were arrested simply for the possession of marijuana in Connecticut, and approximately 1,400 of those were youths. Over these past 7 years, we have arrested roughly 12,000 young people for possession of marijuana only. These figures hold serious implications for the efficiency of our criminal justice, healthcare, and rehabilitation systems specifically. In many Connecticut marijuana-related criminal cases, especially those with a youth defendant, rehabilitation is offered as an alternative to incarceration. This fact is common knowledge among lawmakers, proponents, and opponents of the drug war, and especially children who are interested in drug use. Many youths are fully aware that if they are caught with marijuana, they will simply have to attend a rehabilitation program, and they will be considered clean. If they do not know this prior to arrest, they know it when the judge offers it to them. They've been forced to take DARE. They understand that they go into a rehabilitation program, their eyes glaze over for a few months, and they're all set. Considering the relatively low risk of smoking marijuana, this is a low issue, but it's one of major concern when you consider that there are people who are actually addicted to drugs who cannot get rehabilitation due to a slowed down system. We have people who are addicted, some addicted to marijuana, some to heroin, crack, cocaine, and some even to something as legal as alcohol. These addictions are diseases. People suffer from them daily. They break apart families, they destroy local businesses, bank accounts, you name it. It can destroy lives. People commit suicide over addiction. They need help. They shouldn't be delayed in getting help when they ask for it. If you have the strength to admit that you have an addiction, you should be helped by a system of government which is designed to help citizens. We're straining our rehabilitation programs by forcing 12,000 youth over 7 years into rehabilitation programs. It strains our time, money, resources, personnel. We're delaying doctors, nurses, and psychiatrists from seeing other patients. For example, at the University of Connecticut, we have a Department of Mental Health Services. They both deal with issues of addiction and other psychological issues. And at the university, if you want to get treatment immediately, you have to have what's considered a crisis situation, which is, as far as I understand it, defined as a serious intent to commit suicide in order to get any sort of treatment immediately. If you are not in a crisis situation, you have to wait a few weeks to a month. I've had experienced this myself. This is not unique, and it's very unfortunate. I'll skip a bit here, but we're also encouraging, what we're doing is we're festering resentment against the system by arresting youths and telling them that they are social deviants and they need to be fixed. They're forced into juvenile detention centers, rehab, you name it, and then you turn around and you look at the gang violence program in Hartford, where it's gotten to the level where they're banning certain items of clothing because they're gang related.
Thank you for your testimony. Are there any questions? If not, thanks very much.
Yep.